Southeast Radio's Business Matters with Karl Fitzpatrick.
Well, the Irish health insurance market has been dominated by three players since 1996. However, just last week, a new health insurer, Level Health, entered the market promising to remove the confusion which health insurance customers often experience. Jim Dowdall, the Managing Director of Level Health, joins us now to explain how it aims to make the Irish health insurance market more competitive. Jim, this is not your first experience of the Irish health insurance market, as you previously ran Irish Life Health. So why did you decide to re-enter this space again?
Good morning, Karl. It's a pleasure to talk to you. I'm actually really delighted to speak to you today. The team that have set up Level Health have significant experience, over 20 years in the health insurance market. And despite that and a track record of bringing innovation, there is a competitive deficit in the market. There are only three large institutions in the market, all comfortable with the status quo. And that's not serving the interests of competition. So Level Health was set up to bring that injection of competition, of innovation, of real value for health insurance customers.
So why do you believe that the Irish health insurance market is broken? And more importantly, how can it be fixed?
That's the key question, Karl. It's broken because it is smothered in complexity and confusion. And when you think of it, there are 350 plans on offer in the market by just three health insurers. That leads to huge complexity, confusion, uncertainty for customers. Well, Level Health is the cure for that. We have just a simple range of 4 plans, not 350. They're simply called plans A, B, C, and D, and they provide all of the cover that people need with their health insurance. It doesn't get easier than that. We're the antidote to that complexity and confusion, and it's the biggest issue that needed to be addressed. And then there are 2 other issues that I can go into also, where customers are crying out for better value, and customers are also looking for better access to quality healthcare. Well, Level Health is solving those 3 big issues.
And how did we end up in a situation where there was 350 plans on offer in the first place?
It's a question that could really be asked of the insurers that are there at the moment. There definitely isn't a need for that. The Health Insurance Authority, who's the regulator in this market, has referred to that a number of times, saying the actual volume of plans is eroding choice, not providing choice, because people are confused, they don't understand what they're on. It's not easy for them to make a decision to switch. And that's a key criteria for Level Health, that make it easy for our customers to deal with us. Be transparent, be very, very clear, and be simple to deal with. And we believe that's what will be attractive for health insurance customers. My challenge for the other health insurers would be they should be reducing that. There is really no need for anybody to have more than 10, maybe 20 plans, not 100 and something each.
And how does Level Health plan to gain market share in the health insurance space?
Well, there's two things there, Karl. First, I refer to simplifying it for customers. And the response we've had since we launched to our approach has been overwhelmingly positive. The other 2 issues that need to be addressed are about better value. When families, let's take as an example of 4, switch from VHI or Irish Life Health to Level Health, they can save over €500. They can save more if they're coming from Leia Healthcare. We don't charge a premium for children under the age of 3, and everybody on a Level Health policy gets free worldwide multi-trip travel insurance, free at no extra cost. The other issue that needs to be addressed is about better access to quality healthcare. With Level Health, we cover every public, private and high-tech hospital in the country. We have a greater number of scan centres for your diagnostics, of urgent care and of emergency department access. And on top of that, we have the market-leading telemedicine service where 7 days a week, 24 hours a day, Level Health customers can access a medical professional, a doctor, a midwife, a physio, a mental health professional at no cost, without having to schedule an appointment for some time in the future. They're the issues that customers needed to have addressed. Level Health has addressed them, and on the back of that, customers will switch their health insurance to Level Health.
And of course, the health insurance market in Ireland is regulated by the Health Insurance Authority. Provide us with an insight into the extent of the regulatory process which Level Health needed to complete.
There probably is a reason why there hasn't been much competition in the health insurance market, and that's not in the interest of consumers. It's a very difficult regulatory environment for people to get their head around and for businesses to enter. It's a community-rated market. This is about intergenerational solidarity, where it's the same price for everybody, regardless of their age or health status. And that's a very positive structure to have in our system in Ireland. On top of that, then there's a significant regulation around waiting periods and how they're imposed, and every health insurer must operate in accordance with those. That also is very positive. Then on top of that, we have what's called a risk equalisation scheme, which essentially is a transfer of funds from competitors in the health insurance market to VHI, who are the majority player in the market, the state-owned insurer. And then there's a raft of regulation that goes around that, like lifetime community rating, which penalises customers if they're over the age of 35 and they haven't had health insurance before. That's designed to encourage people to enter the market so they continue to support the intergenerational solidarity. However, the mechanics for risk equalisation and for lifetime community rating are fairly blunt, and they need to be revised because they're not operating in the interest of health insurance customers.
And Jim, as well as looking to attract customers with health insurance plans with existing providers in the market, will you also be aiming to appeal to those that have never previously thought about health insurance?
For sure. And there are always new people coming into the market, Karl, particularly in the younger demographic. And that is really important to support that solidarity that I spoke about earlier on. A community-rated market needs to attract younger people in. Level Health have plans and benefits that really appeal to all segments of the population. And as a country, we need to ensure the stability of the health insurance system. And that means attracting young people in. I think Level Health is the benchmark now for new entrants into the market where they can realise that value I was talking about. Another point that I might make is Level Health is backed by Aviva, and it's a joint venture partnership with Aviva. So our customers have the peace of mind knowing that we're supported by Ireland's leading life pensions general insurance company. It's the largest investment ever in a greenfield health insurer. That shows our strategic intent. But on top of this, as a result of this relationship, Level Health customers can get significant discounts off Aviva, 50% off home insurance and extra 15% off online motor insurance. And that's where we focus our attention. How do we deliver the best value health insurance? How do we make sure our prices are the most competitive in the market? And how do we find other opportunities to add value for our customers?
And from your insights into the market, what are the barriers that are preventing some people from accessing private health insurance in Ireland?
I think the challenges are for customers are around affordability. Health insurance and cost of healthcare is important, and that's why it's in every health insurer. It should be in every health insurer's interest to find every opportunity to manage those costs. That's also one of the pillars for Level Health. We've invested in latest generation technology. Our systems are not legacy systems. We're not burdened by old processes and technologies. So we can have the lowest administration costs forever in the health insurance market in Ireland. That means we don't pass those costs back to our customers. Similarly, a simple range of just 4 plans better serves our customers. It takes that complexity out and it results in lower costs. So health insurers should be focused all the time on taking costs out. And one of the challenges in the health insurance market in Ireland was with just 3 competitors, 3 large institutions who are all comfortable with the status quo. That injection of competition and innovation that forces health insurance customers to respond hasn't been there until now. And that's what Level Health is bringing to the market.
And on the topic of affordability, how do the costs compare to other countries across Europe?
It's probably difficult to do a direct comparison. Health insurance costs in Ireland would be, we all, I think, recognise, a lot lower than the cost of health insurance in America. In the UK, our average premium would be lower than that in the UK, but the UK is a risk-rated market, so you pay a significantly higher amount if you're older or if you're sicker than you might do if you're younger. It's not a community-rated market like in Ireland, so it's difficult to do an apples-for-apples comparison. And we have a very significant penetration. About 50% of the population have health insurance in Ireland. And we need to make sure that is maintained. And that's something government needs to think about, because every person that takes out private healthcare and accesses medical treatment through the private system is alleviating the burden on our already overstretched public system. And we need to consider that. If we didn't have private healthcare in Ireland, the public system would collapse immediately. And so we need to find ways to continue to grow that and alleviate that burden. And that, in the end, results in better quality healthcare for everybody, whether you're using the public system or the private system.
And Jim, is there an element of loyalty within the health insurance market in Ireland, or do you believe that price sensitivity will be an important driver for Level Health?
I think the three issues that I spoke about earlier, Karl, are addressing that complexity and confusion that was locking people in. 350 plans didn't serve the interest of customers. It served the interest of three health insurers because customers weren't really able to switch or change. If you're providing better value, which Level Health is, and if you're providing better access to quality healthcare, which Level Health is also, then people will switch. Like we see some of the media coverage of the health insurance rate increases coming through. One of my own colleagues, before we launched Level Health, had a 25% increase to their annual premium. There was letters in the paper over the last number of days where people were talking about 26% increases. People are looking for better value. We have now provided them with a simple answer to be able to find that.
Is there any stats out there in relation to the level of switching that has gone on in the market in recent years?
The Health Insurance Authority looks at that, and one of their priorities is to enable more competition and to increase that level of switching. The level of switching hasn't been as strong as it needed to be, as it should be, and that's not in the interest of a competitive market. But part of that was because there wasn't real competition and there weren't real alternatives. Well, there are today, so we expect to see that level of switching increase.
And how will Level Health be able to sustain these lower prices in the years ahead?
A key focus for us is about keeping costs out of our business. We've invested in latest generation technology. We have a relatively simple, very simple set of plans that enables us scale in a very, very efficient way.
And in terms of access to diagnostic, urgent care and emergency care centres, how does Level Health compare?
That's a very important one for us, Karl. We cover a greater number of scan centres, diagnostic centres around the country than any other health insurer in the market. That gives convenient access to our customers, and that is a big part of our approach. How do we enable them to have access in a timely manner to quality healthcare? And our approach very much is that more access than anybody else, supported by market-leading telemedicine services where at their convenience they're able to engage with medical professionals without having to pay or schedule an appointment at some stage in the future. So it's the sum of all of that means our customers can get better and faster access to quality healthcare.
And Jim, from a customer service perspective, how is Level Health differentiating itself from the competition?
There are a number of areas there that's very important for us. We have built our solutions where it's very easy for our customers to self-serve. Just go onto our website. We also have supported that with our own apps, our own member portals where people can go in and they can manage their policy, manage their claims, whatever they need to do. So we're very easy to deal with. We also have secure WhatsApp messaging into our support team. No other insurer does that. We have secure WhatsApp messaging into our medical professionals, telemedicine services. No other insurer does that. So our huge emphasis with Level Health is make it easy for customers to deal with us and work with them in a transparent and open way that removes a lot of the confusion that exists.
And Jim, Level Health, of course, is the first new insurer in the Irish market for many years, and we've touched upon the regulatory environment maybe being one of the reasons for that. But on that basis, do you expect that any increase in competition in the years ahead will follow?
I would like to think so, Karl, but I'm not sure about that. There have been three health insurers since 1996 set up in this market, and they've been set up by the team that have set up Level Health, nobody else. It's a very difficult market to get into. I would like to see 6 or 7 health insurers in the market really bringing that injection of competition. It hasn't happened so far. I would certainly welcome it. But that's one of the reasons why we have set up Level Health is that we absolutely believe in competition. We believe in setting a new standard for what customers should be getting for their health insurance investment. And competition is really, really important. No market really works as well as it should do without real competition. That's improved hugely now with Level Health coming in, where we will change that dynamic. In the long term, I'd like to see more insurers in here, but I couldn't tell you I'd be very certain about that happening.
And Jim, finally, why are we not seeing more international private health insurers passporting across into the Irish market?
Part of that, Karl, I think, is because it is a complex market. There is unique regulation in Ireland, which is fine. That's understandable, and it is to protect our community-rated system, which I certainly support. So it's a complicated market to get into. And big international insurers also like coming into a market with a significant presence from the start. They're not really keen on greenfielding. There aren't opportunities in Ireland now for any acquisitions. AXA recently bought Leia Healthcare. Irish Life Health have a big business that's not going to be sold. BHI is not going to be sold by the state, although that is something that should be considered. So there aren't opportunities for international players to come in here unless they greenfield it. The only team that has the experience greenfielding it is the team that's behind Level Health. So it is a difficult market for somebody to enter.
Well, if you've just tuned in, that was Jim Dowdall from Level Health. And we wish Jim and the team every success as they try to gain traction within the market.
Southeast Radio's Business Matters with Karl Fitzpatrick.